Right. I'm very conscious of my own anxiety levels rising while I was waiting to be the last speaker. Really just my talk really will be about why the National Behaviour Support Service was founded following the School Matters report by Maeve Martin in 2006. And we were charged with finding, as a service, how we could promote and support positive behaviour in schools. So I'm just going to take you through a little bit about why we as a service went and discovered and worked on the Friends for Life project, and then talk about Friends for Life and our research. And I'm delighted to have a principal, Adrian Whelan, and Anne from Caritas College, who are here, Anne McCormack, who have been involved in delivering the programme. Our mission statement when we were formed in 2006 was to find how best to support positive behaviour in schools for learning, behaviour for learning. Because I think everybody here at this conference, we all want young people, all students, SEN students, all our students, to have a positive experience in school. And ultimately, children want to go to school to learn. We have developed a systematic continuum of support, and that's the way we work with schools, but it is about evidence-based practice. And I think that's what we're all very conscious. Resources are very limited, and any programme that we have, we want to have evidence that it actually works. Our model of support when we initially started, and we have honed our experience through actually working with young people, with teachers in schools. And I think any model of support has to evolve, because your practice is informed by the parents, by the students, by the teachers. And ultimately, it is a positive experience in school that we are looking at. I'm just very conscious. Have my watch here. But our initial model of support when we started working, and we haven't left this, but we have improved on it, is that schools, we would look at the whole level 1 support, that everything from the moment a child walks into school, they get a sense of what the school is saying to them. And that is the whole school vision, the level 1 piece of what a school is telling them. So a lot of our support as a service would be at whole school. Then we have students who may need extra intensive support, extra supports so that they can access the curriculum. And then we have what we call the level 3 children. We've talked about them here this morning, a lot of the speakers, the students with SEBD, the complexity of students who have more than one condition, and their experience in school can be quite problematic. So as the National Behaviour Support Service, these would be the children that we are working with most consistently. Our model of support, where did we looked at what was happening internationally, we looked at best practice, and what we formed that everything that we were looking at as a service, internationally people were looking at the same. Some of our positive behaviour, the PBIS model in the US, very much about prevention, that you have very good systems using data so that your interventions are driven based on data. The response to intervention. In 2009, the comprehensive integrated model. And just to give you a visual, and I think the diagram is very, very clear, that when a young person comes to school, they want to achieve. We look at the academic achievement, we look at the behavioural, we look at the social. They are all linked. Young people have to have all those needs met to be able to access the curriculum. And I find it sad when we were hearing about 9-year-olds who are switched off school. If a child at 9 is switched off school, it really is very concerning when they come into secondary school. And that key transition people that a lot of speakers, the transition point from primary to post-primary is very evident. So our model of support is very much based on the 3-tier model, level 1, level 2, that you have whole school approach, that all your systems are looking, how does every child experience success? But then we have children who will need intensive support. So this is really just to give you a background of how we work. And as we worked in schools, we felt, okay, we know that there are these 3 levels, but we need an actual behavioural curriculum. We look at a child may be lacking in certain skills to access the curriculum. So our approach is really, we teach the skill. The same as we would teach English, the same we would teach Irish. We look at how we can actually teach the skills that we need. And based on the work in our schools, and it is great to have teachers from our schools, we have behaviour for learning skills. Some children, it could be as basic as walking in the door to actually know how to sit down and sit in class. And this is where our behaviour plan is informed by looking at those particular skills. Academic literacy and learning skills. A lot of young people, there may be an issue around speech and language, occupational therapy. That's why, as a service, we work with other disciplines, and we have really interesting projects going in a multidisciplinary approach. We also have, and one area we felt we needed some evidence-based programs was in the area of well-being, of promoting positive well-being and social and emotional literacy. And this is what drew us to look for an evidence-based program that we would be able to access, that we could research and see did it actually work. Our student behaviour plan, I think most speakers today have mentioned the importance of the student voice in the behaviour plan, of parents, of teachers, because everybody is involved in the experience for a young person. So our student behaviour plan would have 4 distinct boxes, very much what skill do we need to focus on. And I think that is where it was in the area of positive behaviour and trying to promote positive well-being for a child that we were looking for a programme in this area. And this is what drew us to Friends. Richard has already mentioned childhood anxiety. We are very conscious. 2 different Irish reports, 2008, the Bernardo's report, and the recent Royal College of Surgeons report are both saying prevalence rates of almost 1 in 5 children. Now, that is very, very sad for a teacher that if you have 30 in a class, you have 5 or 6 children who are actually anxious. And the thing about anxiety, it is very, very difficult to see who actually is anxious. Managing anxiety, Dr. Ailish Rogers was involved in the project with us, a child psychologist, and Ailish would have said, and I think the thing about managing anxiety, that anxiety is something that can be managed. And I think that message, that is the message that Friends gives our young people, that you can learn to manage it effectively. I just want you to have a look at that slide because I know people from Cork are here today. That is me when I come to the South Ring Road because the anxiety levels, and I think this is something, I'm sure people from Cork and Limerick, the M50 has a similar effect. But managing anxiety, I think the one thing I saw from visiting our schools and observing and looking at teachers running the programme in classrooms is that once teachers, because part of the programme, it's normalising anxiety, and teachers an appropriate self-disclosure. So it is okay to be anxious. It is okay to say that everybody gets anxious, but it's how we manage it. When we were looking for a programme, I myself had run the Philip Kendall Coping Cat model way back in 1990-something, and it was based on cognitive behaviour therapy. It was very similar to the Friends for Life programme and has been cited in the Friends research. I would have run it with a group of first years, and I had the experience of seeing them through to 6th year. And as Richard said, the skills, the breathing exercises that I would have done with the boys in first year, they were still doing when they were waiting to go into the Irish Oral. So that was in 6th year. So I think the long-term effect and the international research, the World Health Organization cited Friends for Life as the only evidence-based programme effective at all levels. Now, I know Richard has talked about the evidence, so I'm very conscious of time and I want to get really to talk about the research that we carried out. But we were very happy piloting this programme in our research project because we knew international evidence said it worked. But as Richard said as well, Barbies on the beach may not go down well in central Dublin, so we had to see, did an Australian programme work in the Irish context? Again, Richard has talked about the difference, so I'm going to, you have that slide for reference. My clicker isn't, sorry, oh no, we're here. And again, We've already talked about the Friends programme and the different, if you look at why Friends programmes were created, there isn't anything there that we wouldn't want young people in Irish schools to experience. Promoting self-confidence, empathy, reducing bullying. And I think bullying is something that's already been mentioned earlier on. It can be the experience of a lot of young people. The coping step plans, a lot of the things in the Friends programme directly affect all those areas and give young people skills to go and talk to somebody. And I think that is something that is a really important part. And I know Anne and Adrian will talk about the experience that they saw from their students doing the Friends programme. Resilience, Richard has already mentioned resilience, the idea to be able to overcome adversity and to achieve positive outcomes. And I think one message we can give, if we can give young people that feeling that they can do it, that they can fail, and I think that's very important, particularly for young people whose experience of school can be very difficult. It is okay to fail. But what do you learn from that? And I think if you have supportive environments, that really fosters that culture. And recognising that normalising emotions. It is okay to feel afraid. It is okay to be worried. But what can you do about it? I'll just put that up to keep you awake at this hour in the afternoon. Coming up to Christmas, I thought it was relevant. Again, This is not a cognitive behaviour therapy programme. Friends is a programme delivered by teachers from a teaching psychoeducational model. I think that's very, very important, and that is stressed in the training. Cognitive behaviour therapy, the idea that you can have a 10-week intervention in a school setting that yields positive results, delivered by teachers, that is really looking at the idea that basically what you think affects what you feel and that you can actually change that. And I think it does give, and I think young people particularly, they get those concepts because it is very positive. And again, the Friends acronym has already been discussed, but I think I'll just draw your attention to here. We mentioned there the negative thoughts and the idea of positive self-thought. And I think looking at young people, the idea that you can, even visualise this big red thought going away and replacing it with something positive and a coping step plan. So every young person gets that message that they can cope. These are just some of the diagrams. One of the sessions is on recognising anxiety in one's body. And just to show you, and these would have been drawn by children, where they would have, young people, where they would have just even thought about how anxiety can present physiologically. And then every child developed their own relaxation menu during the programme. Now, to get on to our research, this was a collaborative project between NEPS, SPHE and ourselves. And I think that if there's one thing I'm picking up today, the more collaborative work we can do together as various agencies and support services working in schools, the better for the school community. We asked 3 research questions. Is the Friends for Life programme effective in reducing anxiety levels? Does the Friends for Life programme have a positive impact on student behaviour? Because remember, we work with a lot of children with extremely challenging behaviour, and that is our remit as a support service. And does the Friends programme help and have a positive impact on that? And can the programme be effectively delivered through the post-primary curriculum? We used screening tools, pre- and post-screening tools, the Spence Children's Anxiety Scale, and we used that with the parent and the student version. We also used the Strengths and Difficulty Questionnaire. These were administered by Dr. Ailish Rogers and NBSS. And statistical analysis was carried out on that. And again, the T-score of over 50 indicated elevated anxiety symptoms. So I'll just let you read through that yourselves in your own time. But really we wanted to do pre and post testing. The actual programme, 42 teachers attended a 3-day training session. We were very conscious that teachers delivering a programme, even though the facilitator training by Pathways suggested a 1-day training, we felt that it's very hard to deliver a programme if you don't have the rationale behind why you're delivering it, if it's based on cognitive behaviour therapy. So we had a 3-day training programme. 499 first-year students were screened in 14 post-primary schools, and 244 first years were selected for the programme by the pastoral care team and the student support team. All parents of students, and we were very conscious, if you screen children and you find that there are anxiety levels, all parents were met and we followed up on the children, and all those children had the programme. 12 schools opted for a small group, a group programme, and 2 did a universal programme. And we have an example from Caritas College of a school that did the universal programme. We were very conscious. Schools are busy places, particularly at post-primary level. There's so many different teachers, so many different subjects. So we felt it important to test those 2 different types of groups. The results. And I think when we look, 1 in every 5.3 students prior to the programme had higher anxiety levels, had elevated levels. After the programme, that had reduced to 1 in 9. So there was a significant reduction in all subsets of anxiety. The themes that came up: bullying, loss, death, other fears. These are fears that children had. There was no significant difference. There was reduction in anxiety, perhaps a little bit more so in the small groups, but it was in both groups it proved. Now, I think the student voice, and I'm very conscious, I don't want to take up time from the teachers who ran the programme, but students reported a significant reduction in overall stress, emotional stress, peer difficulties, behaviour difficulties. The students themselves felt the programme worked. Parents had a similar, they really felt it helped their children. The STQ, to get results on behaviour, we knew there was a reduction, but it wasn't at a statistical level. Qualitative findings, and again, you can read these, but I think the student voice, and I will finish in a minute on this, that to see students talk about their family, to see students talk about coping skills, to me, made the programme such a worthwhile intervention. Parents really felt that it gave their children skills to cope with anxiety. And having attended some of the parents' sessions and co-facilitated some of the parent sessions with the teachers, it was obvious that parents are anxious as well. All parents, everybody's anxious about their child doing well in school. So I think that was very positive. Teacher voice, we used fidelity checklists, we got information, we got feedback from teachers, and the real thing that came out, teachers loved delivering the programme. I'm not going to dwell on that because we have a real live teacher from a school who actually delivered it, and she can talk much better than me about it. How boys particularly got a better language, and that the teachers enjoyed running the programme. Time, you know, the programme does need time. It does need time to plan to implement it. It's a 10-session programme, so there are various practicalities. And I think I'll finish on this because I'm very conscious that we have people who have run the programme sitting here from both primary and post-primary. But if we look at at the educational policy that we're all moving towards, the well-being in post-primary schools, anti-bullying procedures, the Junior Cert framework, the Friends for Life programme sits so well into our education system in that it teaches young people skills they don't only need for school, they need for the rest of their lives. Thank you very much.